When we listen to the radio, we never agree on the station.
Classic rock.
Hip-hop. Pop.
Guys, quiet. The one thing we do agree on, we all want an awesome free phone. That's why we switched to Metro PCS.
Stop by Metro PCS with the whole family and get 4 free phones of your choice from brands you love, like Samsung, Motorola, and LG when you switch. Metro PCS. Wireless. Figured out.
Coverage not available in some areas. Sales tax not included in phone price. Free phone requires port. Excludes numbers on the T-Mobile network. See store for details and terms and conditions.
Blog Talk Radio.
World won't get no better if we just let it be. Na 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 na. The world won't get no better. We gotta change it now. Just you and me.
Welcome to What's New with VHHughes. I am your host, Venus Henderson-Hughes. I do have my guest, RJ Shannon, on the line. How are you? RJ? RJ?
Yes, I'm here.
Okay, there you are. I thought I lost you. I just introduced you. RJ will be holding on the line for us for a minute while I sort of give the play up to her. She's a little bit under the weather, so I wanted to spare her voice just a little bit.
Thank you. That's appreciated.
No problem. So today's show is focusing on the Arizona Black AIDS Task Force. And, excuse me, RJ is a wonderful, wonderful member of that organization, among many others. What I thought I would do for those of you who may not know about HIV, which I seriously doubt, but I wanted to give an overview about HIV and AIDS and then hand everything over to RJ. So, HIV is the human immunodeficiency virus, and this virus can lead to acquired immunodeficiency syndrome, better known as AIDS. The body can't get rid of this virus. It is with you for life. Currently, there is no cure for HIV. HIV, however, can be controlled through proper medical care. Through antiretroviral therapy, people infected with HIV live longer and have a lower chance of infecting others. And I said lower chance. That does not mean that they can't infect others. Before ART therapy, people they really got infected. They went from HIV to AIDS a lot quickly. And due to medical science, they're living a lot longer. Today, someone diagnosed with HIV can live. Sorry, I'm trying to get my cards in order. Forgive me, people. Can live and have a normal life expectancy. Before, if you weren't treated, you immediately went into AIDS, and your life expectancy was probably about 3 years. What happens in HIV is that your CD4 cells are destroyed, and they're destroyed because the HIV virus takes over these cells, and they replicate themselves, and then they destroy that cells, and that brings your cell count lower. Now, the question that I've always had was, where did it come from? And scientists identified a chimpanzee breed in West Africa as the source of the HIV infection in humans, and it is believed that the chimpanzee was infected with immunodeficiency virus known as simian immunodeficiency virus, or SIV, most likely was transmitted from the chimpanzees to humans by people hunting and eating chimpanzees and coming in contact with their infected blood. According to studies, HIV may have jumped from the apes to humans as far back as the 1800s, which really blew my mind in getting this information, because I never thought about, we heard about it in the late 80s, mid 80s or so, but to have it date back as far as the 1800s is really something. Over the decades, HIV virus slowly spread across Africa and later into other parts of the world. And in the United States, HIV existed since the mid to late 1970s. HIV has 3 stages. Acute infection, which happens between 2 to 4 weeks after being infected. You may feel sick with flu-like symptoms. This is called acute retroviral syndrome or primary HIV infection, and it's body's natural response to the infection to feel those flu-like symptoms. But not everyone gets those symptoms. In the infection period, large amounts of HIV are being produced in the body. The virus uses the system, and it kills off the CD4 cells to make copies of itself, and it then destroys those cells. And in this stage, the ability to spread HIV is at its highest because of the amount of HIV in the blood is very high. In time, the immune system will begin to bring the amount of the virus in the body to a stable level. And at this point, the CD4 count will begin to increase, but it may not return to the normal level before the infection. Stage 2 is the clinical latency stage, and it is looked at as an inactive or dormant stage. This is sometimes called the asymptomatic HIV infection or chronic HIV infection. HIV is still active in this stage, but it reproduces itself at low levels. A person may not have any symptoms in this stage or get sick at all at this time. If an individual is on any antiretroviral for nothing today.
ARV sometimes is good enough.
ART therapy, they live longer, and they can live for several decades. However, individuals not using ART can last up to a decade, but may progress faster to the final stage. And we have to keep in mind that although ART reduces the risk of transmitting HIV, you can still transmit it. Towards the middle to the end of this period, your viral load begins to rise, and CD4 cells, your count begins to drop. And when this happens, you begin to have symptoms of HIV infection as the immune system as your immune system decides to try to fight and protect you. So then that leads you to the final stage, which is, of course, AIDS. And in this stage, the immune system is badly damaged, and you're vulnerable to infections, and infections related to cancers and opportunistic illnesses. When the CD4 cells fall below 200 cells per cubic milliliter of blood, you are considered to have progressed to AIDS. A normal CD4 count is between 500 to 600 cells per milliliter of blood. A diagnosis of AIDS is possible if you develop one or more of the opportunistic illnesses, such as the cancers or pneumonias that happen. Without treatment, people with AIDS, with an AIDS diagnosis, survive about 3 years. However, and this is the one that really blew my mind, once someone has an opportunistic illness, life expectancy without treatment is up to a year, and people affected with AIDS virus need to have medical treatment to prevent death. So then I decided that now that we have our backdrop of what HIV is and how it goes down, well, since we're speaking to the Arizona Black AIDS Task Force, what's our statistics here in Arizona? So currently, as of 2012 statistics, I believe, our emerging cases of HIV for whites are 189 cases, which I was like, wow, that's a lot of cases. For blacks, it's 90 cases of HIV. For Hispanics, it's 157 cases. For our Alaskan, Pacific Islander, or Hawaiian, there are 10 cases, 10 known cases. American Indian or Alaskan Native is 34 cases, and mixed race, 8 cases. And on the other hand, when it comes down to our emergent cases of AIDS in our community, our white brothers and sisters, we have 67 cases. For blacks, we have 17 cases. For Hispanics, we have 53 cases. Asian, Pacific Islander, or Hawaiian, we have 6 cases. American Indian, Alaskan Native, we have 12 cases. And for multiple race, we have 0. So looking at all of that, and RJ, you do all of this all day.
Well, not all day, but okay.
All day, just, all day. Definitely it is something to look at when I'm looking at those statistics, and these are the most recent statistics that I pulled from the Arizona website.
I was going to ask you, are those actual cases or are those rates?
These are the actual cases. I didn't do the parts for 100,000 of the population. These were the
for 100,000, because we actually have somewhere around, I don't remember exactly, about 15,000 people in Arizona live with HIV or AIDS.
Wow. So these were, I guess these were our cases, or our first emergent cases in that year maybe. So it's
for
not
which
lumping
year?
For 2012. So these must be the newly diagnosed cases from what I looked at.
Yeah,
which I guess is I'm not going to say it's not that bad, because I'm not going to say that, but as far as how rampant it is, as far as an illness that is out there, and I know that the rates have went down. However, we still have people infected with HIV and AIDS.
Oh, sure. Like I said, we have over 15,000 people, it might even be 16, that are in Arizona that are living with either HIV or AIDS. And so to me, those numbers sounded really low, which is why I was asking whether or not those were rates instead of just hard numbers.
No, these are just the hard numbers that I pulled from the actual, because I really, of course, you know me, I'm a county, I look at all the different counties, but this was the actual ones where they basically broke down, okay, this is your cases for this, and it was just for the year 2012.
And is that just Maricopa County, Venus, or is that the state?
This was for the state of Arizona that I found that information on, and it was the second to the last PDF? But I believe the last one was the one that looked at the whole state in itself. So this one was just black, white, Hispanic. And,
right, it's the ethnic breakdown.
Yeah, it's the ethnic breakdown. So I really wanted to take a look at that particular one, and I know that we have, and there's so many, which I love the way that is actually set up, because you can find any statistics you're looking for with regard to HIV and AIDS on that actual website.
Did you go on the DHS website, the Arizona Department of Health Services?
Yes.
It's fabulous.
I love that,
really
and they're very much
job.
up to date. They are very much up to date. I'm
very
much
up to date. And normally, no matter who you go through, whether it's the Centers for Disease Control or what am I trying to think of? Health and Human Services or DHS, and basically CDC and Health and Human Services are getting their information from state health services. But we usually are about 2 years behind in terms of reporting data out. And Arizona just does such a tremendous job of really kind of keeping up with it. They put out annual reports that are wonderful reads, because they not only look at, it's not just about the numbers in the report, but there is who are the specialized communities, where are we really starting to see trends happening, whether the trends are reflecting that that their health results are getting better, or that we need to really keep an eye on certain communities because they're having more problems. And really, the story of Arizona is the story of what's going on around the nation, in that the trends are telling us that of course we need to always be on the lookout for our communities where men are having sex with men, because they have always been number one where this virus is concerned, and the virus has not gone away. And in certain communities within the community of men who have sex with men, there may be trends where we really need to keep an eye out, and primarily that's with our communities of color within that community. So we know that nationally we're seeing higher rates of new transmission among our African American men who have sex with men. The Latinos are not too far behind, and then Native American men. And white men across the country have been doing a lot better. But I think it's because they have, from the early days of the early 80s, they were very vocal about the government responding to this heinous disease that was really taking out people very, very early on, because no one understood what it was and they didn't know how to respond to it. And because it was happening to gay men, people in the country weren't particularly supportive or sympathetic. So they spoke up for themselves and really made it a point of seeing to it that the government was accountable and that community services were accountable, and that the research that needed to be done was being done so that we would have the biomedical response to HIV and AIDS. And around the world, there was a response from the scientific community so that early on they were at least able to say, well, this is the name we're going to call it. We can see that there's suppression going on. That is. And you did such a great job. I'm sitting here thinking, I don't know what she needs me for in terms of describing what the virus does and all of that.
Well, I really wanted to have that out there. I'm big on educating, of course, and of course you definitely were a great help to me going down that road. But I really thought that it was something that needed to, because we don't talk about the beginnings of it. We talk about what we're in now. We don't talk about.
Well, and I think that in some ways, even for me, talking about the beginning is somewhat irrelevant, because what happens is that people, I get into these discussions with people sometimes, and I hear a lot of crazy stuff. Like I was really happy to hear you talk about I believe it was a chimpanzee or a monkey, but that people ate it, and that may be how that the transmission started. It may be, we're not really sure. But I actually was engaged in a discussion with a woman not too long back who was just assured that, white people had forced black people in Africa to have sex with monkeys, and I couldn't convince her of anything else. That's when it becomes a discussion that to me is a waste of time. Yeah. Because what we are dealing with, kind of going back to that discussion among trends, is African Americans across the country and in Arizona are at the highest risk. It's where trends, if one is going to die because of AIDS-related issues, they're more than likely going to be African American or poor. And we're seeing that, in communities across the country, and we're seeing it here. And so the discussion about where it started, even though it is somewhat important for those of us who are geeks and care about that stuff, even though it is somewhat important, I have to always look at what's going on now, because I've attended enough funerals of black folks, white folks, and Latino folks, and Native folks to say it's the human immunodeficiency virus. It is a virus, and it really doesn't care who you are or who you sleep with or who you shoot drugs with. What it cares about is that you make the mistake of, and I don't even want to call it a mistake, but you participate in those activities without protecting yourself. And when you do that, and you do that with someone who is HIV positive, then there's always that the possibility of becoming infected. And so that's what I'm really concerned with. And then it's not, in Arizona, it isn't just about HIV. I mean, we also have issues with hepatitis, and especially hepatitis C. We have huge issues with gonorrhea and syphilis, especially in the African American community. And I want to clarify something, because I am not only a member of ABATF, but a founding member of ABATF. But I'm also staff to the Arizona Department of Health Services.
Yes, you are.
In the Bureau of Tobacco and Chronic Disease, and our HIV prevention program is under that umbrella. And so it's also a part of my job, not just my passion. And it is a huge passion for me, which is why I'm blessed to have it also be part of my job. But looking at the disparities with HIV is incredibly important to me, because I want to know why certain communities, not just in Arizona but around the world, are facing these huge high numbers of HIV. And internationally, there are, I believe, 34 to 35 million people that are living with HIV. It's what we call prevalence, that are living with HIV or AIDS. And so many of those, and our highest numbers for prevalence and incidence have always been in Africa. And so, for many folks, they have called this like the black person's disease. And
yes,
and there's so much
complexity
to it. Yeah, there's a lot of complexity. And Friday is the National Day of Awareness for African Americans in HIV, and I've spent really my entire weekend going to events. We were actually at a church this morning handing out condoms, and HIV testing was still going on even when I left, which was wonderful. And many people came up and got lots of good information, took condoms with them. They weren't embarrassed to do that. Heard a phenomenal story from a young woman who has actually, she said she was diagnosed when she was 17 and was now 48 years old, and actually had never been on any medications until she came to Arizona and got valley fever, which is actually a very common story. It's one of, it's one of those infections that for a healthier person, it makes healthy people really, really sick.
True.
So now imagine what it's like when someone who is HIV positive doesn't necessarily have to be sick. She had been very, very healthy, but she does have a compromised immune system, and so valley fever was actually capable of making her quite ill, and she had to go on meds, and she's doing very well. She's doing very, very well, and her message was, I am alive. There's life after HIV. It is not a death sentence. But for African Americans, it is so incredibly stigmatized that even discussing getting the test, without talking about the sex that's involved,
right.
It's so incredibly difficult. We don't like doing that, and somehow we have to find methods of...
Now, RJ, you mentioned about the church, and I know that especially in the black community, I grew up Baptist and things like that. So, in the church community, we're not even going to segregate it to just the black community, but in the church community, to take something so up close and personal, and have it basically sat in front of the congregation it seems to me as a rarity. To have a church that would actually not only speak about HIV and AIDS and any other STDs, but to actually permit HIV testing, that is a rarity.
Isn't that phenomenal? Yeah. Then there are actually a couple of churches that have allowed that in the past. We have a couple of young activist African-American pastors in Arizona that are just amazing to me. They are my heroes. And we have some female pastors as well who are activists and are not afraid to stand up in front of their congregants and say, it's time we paid attention, it's time we told the truth, and it's time that we took care of ourselves. And I was thinking about that even as I left the church this afternoon to rush home to get your call. But I was thinking about, because a couple of people looked really shocked when they walked over the table and they found out what we had. Because we had female condoms, male condoms, lube. We had the whole nine out. And a couple of people looked really shocked. And then when I talked to our friend Christina, actually, I was talking to her about it, and she said, well, they're shocked because it's in the church.
Right.
And then I thought about that on the way home. And I haven't belonged to a church since I was 18. But I thought, I can't think of a more appropriate place for it to be than in a church. This is the thing about working in HIV is that you have to do it, and one of my mentors who has long passed away had said to me, you can't do this work with judgment. You can't do it. You have to be able to open your heart and your mind to the people living with the virus and to those at risk for the virus. You have to give what you can. If you're whether you're a good Christian or Muslim, or it doesn't matter,
Right.
It's one person helping another. And to me, of all the places on the planet where one hand should be out to lift up another, it should be in a church, where real discussion and truth telling happens. To me, should happen in the church. So, at those times when I've been blessed enough to be in a church where there is a pastor that's willing up to tell the truth about HIV, to talk about sexuality, to talk about how it's been used against us. I mean, that's why I ain't mad at black folk. I understand why it's so difficult. Because historically, our sexuality has always been used against us by the majority. And so, and we have worked so hard to assimilate and be accepted by communities that really, no matter what you do, you're not going to be accepted. I mean, let's face it. And it's not that all communities are that way, but
you're right.
It's such a waste of energy to try to be or copy another group instead of just being yourself.
I think that we, as black people, we are extraordinary and we're fabulous. And
absolutely, we're so gifted.
We have, and that's exactly why I love the fact that this show started in Black History Month, although for me, I celebrate us every day of the year.
Every day.
Because I'm not just black in February. I'm black every day.
Every day. When you wake up in the morning, when you go to bed at night, we are always black. And I really think that so much of what we see in the black community when it's related to HIV, especially in the sexuality, is that there's so, there are folks out there who would say you got to forget what happened 400 years ago, but the fact is it's in our genetics.
Yes.
And so it's not something that's going to go away just because somebody with a good heart and meaning well comes up to us and starts asking us questions about our sexuality. Have we been tested yet? If we know what our status is, why aren't we getting treated? I mean, and people get very frustrated with African Americans around that, and many of us within and without and outside of the community are really upset with our spiritual leaders. But the fact is that there's reason for why we've been the way that we've been. It doesn't justify it. It doesn't mean that we need to keep our minds in those places, but we need to recognize that there's reason for it. And then we got to try to do our best to come up with real strategies on addressing the reason, because a lot of that still hasn't changed. Sexuality is still used against African Americans. No matter how ultra-conservative we try to behave, it still gets used. And in fact, I can't even tell you how many times over the years people have asked me, who were not African American, well, why is HIV so prevalent in black communities? Is it because they're having more sex than other groups? And in fact, they were assuming that we do. And being 60 years old,
laugh. It's just really...
I know, but I think it's funny because I still do this when I give lectures. I'll tell people, if we were having that much more sex than other groups, I would be smiling all the time.
Oh my goodness! I mean, you are such a mess.
But that, of course, it's not true. That the research has been showing for years that we don't have any more sex in any other groups.
No.
We don't shoot any more drugs in any other groups. That is not the issue. The issue is that the virus has been in our communities from the very beginning.
Exactly.
And we didn't do anything about it, and neither did the medical community. And for us, it was just something else to be stigmatized about. and we have so many other issues as Black folks in our lives. We are still the group that is going to be more than likely living in poverty in a community.
True.
Struggling with racism and oppression in a community. If you're gay, you're dealing with the homophobia, not only from the outside community, but from within, because we are so incredibly we are so incredibly homophobic. And you know, again, faith leaders could take a role in helping to remove that, and they've not done such a great job.
Well, that takes
the
a
good
lot
news
of growing.
Is it's getting better.
It is
getting
better.
To be honest, it's getting better, and in fact, the NAACP was here in Phoenix last week, where they had a special training with pastors.
Nice.
And yes, and my understanding was 30 pastors showed up for it. And they came from all over Arizona. And so that shows to me that finally, after so many years of meeting with pastors, that people are actually starting to want to be involved. I think part of that is because by now, 2014, you can't be in a room with Black folk where, I want to say this more better. The majority of Black folk in any room know somebody who died or lived with HIV. The majority of them.
The majority of them.
It doesn't even matter where the group is. It doesn't matter if it's at one of our clubs. It doesn't matter if it's at a church. It doesn't matter if it's in a school. It just doesn't matter. If you're in a group of Black people and you ask that group, everyone who has known someone who has lived or died from HIV, raise your hand. The majority of the hands go up. And that's true here, and it's true across the country. So it's something that has so highly affected our community that I think there are people who are just ready to stand up and do something about it now. I know that in Tucson, they've had a group for 20 years called THUN. And THUN is Tucson Interfaith HIV/AIDS Network that was started by a wonderful guy named Scott Blades. He pulled together a small group of faith leaders, and this was the early days of the virus when you were diagnosed, you would be dead in a very short period of time, as you shared earlier. And so he brought these faith leaders together to say, look, you know, there isn't a cure. We don't know what's going on with these folks, but they certainly need help in passing. They need help in the short lives that they have. Let's make it as safe and full of the Spirit as we can. So he pulled together faith leaders who their churches or synagogues or temples would do things like take the patient to their doctor's appointments, make sure they had groceries in their homes, be there for them when they did pass. I mean, so it was all about preparing the person to die in the early days of THUN. And now THUN has really expanded and grown so that they're actually doing prevention. And again, the leadership is all people of faith. We have an organization in Phoenix now that's working with ABATF, and they're wonderful. They're called MIHA, and it's Maricopa Interfaith HIV/AIDS Alliance.
Nice.
And exactly, and we're trying to work together to develop. And I actually saw my friend Scott the other day, and I said, you know, we still need him because he's done this model for so long.
Right.
The best way is to get people from all faiths together to act on what they learn about HIV and give service to those living with it and those at risk. I mean, to me, there's still the other prevention piece to this, because our focus in HIV for a long time, and should be and is, you know, if you work with those who are positive, if you can identify those folks who are positive and get them into treatment, there really is a lot less chance that they are going to transmit the virus to somebody else. And in fact, the state has a couple of really great programs right now where they're testing out of the emergency rooms, where a lot of people get their care. They're not going to a regular doctor. They don't have any money. They don't have any stability in their lives. For them, it would never be about picking up a phone and calling a doctor when they don't feel well. So if you go into the ER, even if you just stubbed a toe, you're going to get an HIV test. And they're actually finding people that way. So a lot of the time you have to think about, you know, meeting people where they're at, where they're going to be the most comfortable.
And that's exactly why I have, H3P, because of the fact is that I know that is definitely a need out there, and I'm thankful that we did connect on that. So, by all means, anybody have any questions, give us a call at 347-826-7959. So, RJ, tell me, when was the Arizona Black AIDS Task Force created?
Wow, I was trying to think about that this morning. It's so funny because when you're involved with a lot of different groups and things, those
I know you juggle a lot of hats,
along.
RJ.
I do. I belong to
a lot of hats.
But it seems to me it was 2008.
Okay.
I think it was about 2008.
Not too long after I got here. Because I got here in 2007.
And it's it's gone through some changes, some growth spurts, and then it shrinks and it kind of goes away for a little bit and then it comes back. But the whole reason for starting ABATF was we really wanted to have something first of all, let me say this, that our Native American people have had something that addresses HIV and sexuality for many, many years, and I'm saying probably 15 years now.
That doesn't surprise me.
Exactly. So when I found out that they had this group and I was a part of it and was so welcome to it, and in fact, we are getting ready to reinvent the Indian Task Force and bring it back.
Nice.
It's a wonderful group of people from all over the state. Several tribes are represented there. And they are the other group that is most at risk for death due to HIV and AIDS. And really it's because of late diagnosis and because it's so stigmatized again that when diagnosed, a lot of time they won't go into treatment. We do the same thing.
Mm-hmm.
We are brothers and sisters under that umbrella of self-stigmatization of ourselves and then the virus too. So they face a lot of the same challenges. But when I saw what was happening with the Indian community, I thought, I sat down with my manager and I said, we need to do something with the Black community. We need to bring folks together. So we had the idea of creating the task force, but it was really, our focus was to start it, but to hand it off, to make sure that it was driven by community members. So I'm there as, a state employee to support, but it's important to me that the leadership and that the voices come from the community. I've believed for a very long time that the way to eradicate the disease is for our communities, no matter what community it is, to own it. We got to own our sexuality. We've got to own our own behaviors. We've got to own the virus as well. And that there's no shame in that because, again, it's a human immunodeficiency virus. So the virus itself doesn't care who has it.
Exactly.
But we can own what we do, who we do it with, how we do it. We can own those things. And it's important that we not, in our conservatism, and you notice I say that quite a bit because Black folks really are fairly conservative about a lot of stuff. In our conservatism, we can no longer hide stuff. Our secrets hurt us. And sexuality is not something to be ashamed of. It's part of who we are. And to not be able to talk about it, to not be able to teach your children, your grandchildren, your friends, because we also see trends in older people with HIV and other STIs.
Yes,
the reason why we see that is because people 50 and older get divorced and widowed. Women at those ages don't really concern themselves with protection because they can't get pregnant. So older people date, and they have sex, and they go out to dinner, and they have multiple partners, and they do all the things that younger people did, and they probably have a lot more fun because they don't have kids to raise.
Don't have to worry about getting back for the babysitter.
They're not worried about that stuff. So it's all about kind of this new life that they live, and they're not very good at protecting themselves. And so, again, it's about being able to educate your peers, no matter what age group they are. And I think as not just Black folk, but as Americans, we need to do a better job of accepting the fact that people are sexual from the time they're born until the time they die.
Oh, now you want them to be responsible and own things? I mean, you're asking a lot, RJ.
I just can't help myself. I can't help myself.
You're asking a lot. You want them to be responsible, and if they mess up, you want them to be accountable. Oh my goodness, that is something.
Yeah, I mean, we expect that of people for nonsensical things.
Yeah,
so,
we do.
So why can't we do this when it comes? I mean, I've actually heard people say that rather than there are people who would rather admit that they were junkies than admit that they had HIV. It's like, are you kidding me, really? Or a lot of that stuff we talk about in the Black community, when we talk about the down low, which, by the way, and I heard a wonderful young man articulate this when we were in Tucson on Friday, because they had their national event on Friday.
Right.
He said the down low isn't just about Black folk or Black men. It's white men, it's Latino men, it's Native men, and these are all communities where a man who has had sex with men or has sex with men may not even identify as gay, but does have sex with men off and on, and some of them actually have sex with men and women. But the fact is that within our communities, they don't feel safe. Mm-hmm. They don't feel safe from the time they're children through teenagerhood and into being a young adult to an adult. We don't create environments where they can be themselves. Therefore, they must hide out within their own communities. That's something that, when I say accountability, we talk about loving each other, but love is an activity. It is a behavior. It isn't just what I feel. It's what I do. And
it's definitely an action word, and I always find it very interesting, especially talking with young people where they don't want any kind of limit on things, and yet there are so many limits. And I'm astounded by the fact that as a young person you can fall in love at the drop of a hat and do God knows what to yourself and to that person. But if it comes out that person has done something, or if you've done something to that person and didn't relate what you had done, and they find out later, then you want to play the pity party, but you knew ahead of time, and I see that, and this is why I created the TEAS program, and now I have the H3P Senior Initiative, because we do not have anybody being accountable out there. If they were, we wouldn't have the statistics that we have out there now in the senior community, in the teen community, and all around. We wouldn't have that. We would be acknowledging that, by the way, this is my situation.
And to be fair, I want to say this about us, especially as African-American people, and that is because I'll tell you what, Venus, there's nothing that makes me crazier than hearing about, babies' mamas and babies' daddies. I'm like, it makes me insane. I can't even tell you how insane it makes me. But, what I recognize about us as a people is healthy relationships don't come to us easily.
No.
And I think that part of that is because we are so busy being in survival mode. Mm-hmm. And what I mean by that is that even from the early days of slavery through Jim Crow, through the 1950s, pre-Johnson, Lyndon Johnson to Kennedy, from Kennedy to pre-Johnson through the Vietnam War and Reagan, throughout our periods here, it's always been about us being in survival mode, always. And because we're so busy being in survival mode, we actually do things to each other that are meant to help the other person to survive, but aren't necessarily the healthiest things for them. And I'll give you an example of that. We all had those mamas. I don't know about your mama. I'm old, so I got one of those 93-year-old mamas. But I had, in the 1950s when I was growing up, everybody's mama got to watch everybody else's kid.
Yes.
And they reported on you when you came back. And the response to you doing something that was, something you shouldn't have been doing as a kid, what they call something bad or whatever, like missing school or whatever, was to pull the branch off the tree and flip you.
Yep.
Now, I look back on our history and what happened to African Americans. African Americans were beat daily by branches, by whatever, by
whatever was at hand,
by whatever, and killed. Many of us were beaten, killed, hung, strung up, castrated. So we have passed on. We have carried with us this violent activity that we do towards our children and ourselves. I mean, and I don't think we think much about that. We've found ways to justify it.
Right.
But
I
it's
see a lot
harmful.
of that on Facebook.
It's harmful because when that's your response to someone is to hit them, what it tells me is that you're out of control, not the other person you're hitting, but the person who's doing the hitting is out of control and can't think of another way to respond to it. And another example that I actually heard this wonderful PhD who is going around the country speaking to a lot of groups about the healing of African Americans. And in fact, I'm going to be doing a lecture soon, and I'm actually stealing a lot of what she's talking about because it's just so relevant and brilliant. What she talks about is, and her name is Joy DeGruy. I'm not even sure I'm saying her last name right, but it's like a D''Gruy. She gives the example of these two mothers who are comparing the activities of their kids in school. One is a white mother and one is a black mother, and the white mother is very proud of what her white son has done in terms of doing well in the classroom, and the black mother says, and then the white mother starts talking about how well the other woman's son is doing, and in fact he's doing better than her own son. And the black mother comes up with some sort of statement of, but you should see him at home. I mean, he's always cutting up. I mean, she cannot accept the compliment for her son. She can't do that. And again, it is perhaps her way of protecting what her son is becoming so that he can become it without somebody getting in the way of that. And so, I think that part of it, because I think I saw it in my parents too, was this fear of too much boasting, of never really being able to pay a compliment, but to keep us challenged all the time. In doing so, we didn't have particularly healthy relationships with one another. Kindness really wasn't in the middle of our home. Kindness wasn't really there. And I guess I'm saying that to say this: we have many, many issues as black folk. Healthy relationships is one of the major problems that I see in our community, especially when you look at the numbers of folks who are living in violent relationships, whether it's parents, child, or partners. And that has, in too many instances, become our response. It's also, for the person who's being victimized by it, it is a really easy way to transmit HIV or an STI to somebody because they're not going to have any control over their own sexuality or their life in a relationship like that. So, and it's far more difficult for them to speak to what keeps them healthy, whether it's about sexuality or something else. So there's a lot of healing that we have to do as a people. There's a lot of talking that we need to do. I don't even really want to call it talk therapy. I don't know what that looks like really. I think for each black community it's really different depending upon their culture. But it's certainly discussions that we need to have. And I meet a number of women, especially my age, who are actually looking for places to go to start to have these kind of dialogues because they've been through a lot, and in their lives there's been no place to talk about it.
That is true. So when it comes to the Arizona Black AIDS Task Force, and the group of talented, boy, you guys are talented. You talented individuals. when you come together, what is it that you guys do for Arizona as a whole?
Well, we're still working on that, but I tell you what, you're right, that we have such gifted people sitting at the table, each with their own story about why they're there and why that passion is so strong in them to volunteer time to be there. It's quite amazing. And excuse me, I know that part of our vision is to we don't use the language of empowering people because people do that for themselves.
That's true.
But we talk. Yeah, they do. But we are very committed to making sure that communities become educated if they're not around HIV and the risk for it, along with other STIs, to have real conversations around sexuality. We go out to public and private events for information, and we always try to make sure condoms are available and that HIV testing is going on wherever that we show up. We try to make sure that can happen, or at least that becomes something that can happen in the future. Mm-hmm. And in the past, we've also done like community town halls so that African-American leadership is invited, or just, our community members. To me, every member is a leader within their community. So we try to have at least once a year some sort of an event where people can come together and talk about their issues and try to come up with real solutions to those as well, so that it's not just talk, because talk gets old. So our commitment is to stop the transmission of HIV within the Black community within a period of time. We don't know what that looks like yet because it needs to be realistic. To stop the transmission, but to also make sure that anyone who's of African descent and living here with HIV gets treatment for their HIV. And understanding that there are so many challenges for people of African descent here. What people don't realize is that treatment doesn't have to cost you anything, especially if you don't have any money, that there really is a system that's been put together to make sure that people living with HIV get treatment no matter what their income is. And that there is a continuum of services beyond the actual ARTs and your medical care. There are other things in place for people living with HIV. There's housing for people with HIV. There's case managers that can help people with transportation, making sure that they're getting assistance for food if that's necessary. All those pieces that help to make a person's life a little bit easier are already part of the HIV care system that's been put together. And I think that people of color are not aware of that. In fact, when I do lectures with people of color, no matter what age group they are, they tend to not know these things. So it's important that we stop assuming about what's out there and actually go out of our way to find out. And there's actually a great website. It's hivaz.org. And you can go on that website, and it has pretty much everything there. It is statewide. So if you're looking for any kinds of testing services, care services, counseling services, a lot of our folks are facing substance abuse issues. You can find all of that out on hivaz.org. And it's such a lot of what happens to us is just because we haven't gone out of our way to find out what we need to find out, and so we maintain our fear. I can't tell you how many people I've met over the years that have said, I knew I was HIV positive, I just didn't want to get the test to confirm that. Or I knew I was HIV, and these are African Americans I'm talking about. I knew I was HIV positive because I got the test, but I just didn't care about getting the treatment. I didn't want to deal with that. I had other stuff to deal with. I mean, and I've met people who have waited as long as 10 years.
Wow.
And it wasn't because they weren't sick, because they were. It's just they got so sick they finally had to do something about it. And that's us. We do that. I mean, and if you think about Black folk and health care and health disparities among Black people, it is not unusual for us to be living with diabetes or heart disease, COPD, other issues, and we will not go get care. So HIV really isn't that unusual when you look at how we see care systems, how we see our bodies in illness, which is a whole nother, that's another hour of discussion. But I even heard it today at the church I was in where someone said, the doctors told me I only had 3 months to live, but then the nurse ain't God. So she said, I put my hands...
That is another discussion.
That is a whole other discussion because in many ways that worked for her, but in other ways
it doesn't.
It's got to be the combination. You can put your body, you can give your body to God, but you still got to go get your medication.
Exactly. Exactly.
So,
I explained that to somebody recently, and I got to speaking about, of course, when we have health disparities, mental health in the Black community is a huge one as well.
Huge issue.
I sort of, me being me, RJ, you know me.
I know.
And I basically said, yes, God is in control. Okay, I get that, but if I got schizophrenia and I'm not taking my medicine, I'm not going to hear God. I'm going to hear somebody else's voice. So I need to take my medication. And they sort of looked at me sideways, but
it's true.
I was serious about that.
Well, and that is, even though we don't really have time to talk about that, that is a major. They're finding.
There's a show coming up about that sometime later on. I've always wanted to have that forum.
There's high risk for people with behavioral health issues for HIV too.
Yes.
So I mean, all of those are so very much connected, and I know we're winding it down, but a final message that I want to make sure is heard is that HIV really became the representative disease that actually put light on human and social justice types of issues. That when you think of HIV, it was something that really affected people of color around the world, our poorest people, our countries that are at war, our women who are vulnerable because of violent situations and relationships, our children, because many are still being born HIV positive, even though that's not true for our country. Our country has done a very, very good job of almost eradicating that. We still have some that are born, but very few. So, I mean, it shed light on the fact that human rights and social justice are so very much tied up into a person's vulnerability for this virus. The protections of the medical community and social systems and judicial systems, because there's a whole other conversation around the number of people of color who locked up in prison, who go into prison with HIV or other STIs, who will not get treated because they won't be tested for them while they're there. I mean, there's and the high-risk behaviors that happen once you're in prison. And the overrepresentation of people of color, especially our men of color and our women of color, our African-American folks, being in prison systems. You can talk for an hour or 2 hours about the number of black folk locked up in Arizona prisons, the privatization of prisons, okay, so there's only 90 seconds left. So at any rate, I just want to say that all those pieces are connected when it comes to HIV.
So before we end this, because we got a few seconds left, tell everyone how they can get in touch with you and the Arizona Black AIDS Task Force.
Oh, absolutely. You can call me, actually, at 602-364-3603. I'll say that again, 602-364-3603. Or you can even write me. I'm sorry, I don't remember the ABATF. ABATF actually has a Facebook page, so please, you can go onto the Facebook page for the Arizona Black AIDS Task Force.
I'll make sure I share that with my people.
Thank you so much. Or email me.
You guys have a Twitter also, right?
Huh?
You also have a Twitter account as well, I believe. I think I'm following you guys as well, so I'll make sure that I share all that information. RJ, as usual, you have been a great delight to me. Thank you so much for taking time out of your day.
Thank you.
And definitely we will be in touch. And if anybody has any questions for RJ, definitely you can send them to me at VHHughes at H3P. one.org, and I can forward them on to her, as well as the Arizona Black AIDS Task Force. RJ, thank you for all that you do.
Thank you
for
so
Arizona
much.
and for our community.
Oh, thank you.
Have a great day.
You too.
Bye-bye.
From the kids' table to the office party table, the game day table to the Thanksgiving table, Smart & Final has everything you need to make your table special. Party supplies, everyday groceries, more club sizes than club stores, with prices up to 25% lower than supermarkets. And make your holidays easier. Order at smartandfinal.com and your first delivery is free. Now, fresh Hass avocados are 67 cents each, and Foster Farms chicken drumsticks or thighs family pack are 77 cents a pound. Limit 4 packages.